Despite hundreds of deaths every day with the virus, Boris Johnson has today announced his plan to live with COVID in England.
Mr. Speaker, COVID will not suddenly disappear. So those who would wait for a total end to this war before lifting the remaining regulations would be restricting the liberties of the British people for a long time to come. This government does not believe that that is right or necessary. Restrictions pose a heavy toll on our economy, our society, our mental well-being, and on the life chances of our children.
The Prime Minister promised to present a plan for living with COVID. But all we've got today is yet more chaos and disarray. Not enough to prepare us for the new variants which may yet develop. An approach which seems to think that living with COVID means simply ignoring it. This morning he couldn't even persuade his own health secretary to agree the plan. So what confidence can the public have that this is the right approach?
Right, so from the 24th of February, which is this Thursday, subject to approval in Parliament in the next couple of days, the government will remove the legal requirement to self-isolate after you test positive in England. So adults and children will continue to be advised to stay at home if they test positive, but this is public health advice. It's not legally binding. They'll no longer ask vaccinated contacts of COVID cases and the under 18s to test for 7 days after they come into contact with you if you have COVID, and the legal requirement for unvaccinated close contacts to self-isolate will be removed from this Thursday. Also from Thursday, routine contact tracing is going to end. Advice for children in school and teachers to regularly test themselves with lateral flows, that is going to end as well. And the £500 self-isolation payment is going to end too from this Thursday. That's very worrying to a lot of unions and employment rights type people, because some people do not really have this choice professionally if, for example, they don't have symptoms, but they do know they have COVID, to sort of just stay at home and not go out and earn a living. From the 24th of March, we have more changes in England. So the COVID Day 1 rules on statutory sick pay and employment and support allowance, those are going to go. And unions are very, very cross about this, because that was something that was brought in during COVID. You could only claim after 4 days and 7 days respectively before, and that was something that helped people self-isolate and do the right thing to protect others. So that's going to cause a lot of a row. And then from April the 1st, free universal symptomatic and asymptomatic testing is going to end for the general public. We're talking lateral flows, we're talking PCRs. It's all going to end from April the 1st. And in fact, they've had to bring in a change from today to try and stop people stockpiling these lateral flow tests. There will still be some testing, but it's going to be very thin. It's essentially in the NHS and social care. It's not going to even be sort of regular testing for all staff. It's only going to be scaled up if there is a problem. What you will have is regular testing of social care residents and testing of people who go onto an NHS ward or into surgery to make sure they don't have COVID and infect the ward. But guidance will be updated. A sort of full list hasn't been produced yet. And essentially, if you're a member of the general public in England, from April the 1st, you are going to have to pay for your test yourself. The government doesn't know how much private providers will charge, but it's thought to be in the low single-digit number of pounds per test. So figures of £20, £30 for a box of 7 don't seem incredibly out there for lateral flows. PCRs obviously cost more. So what will stay? Not very much is the answer. There will be domestic surveillance, things like the ONS COVID infection survey, which some people were calling to be scrapped. That is going to stay. The Siren and Vivaldi studies, they're going to stay. And an ability to ramp up testing is going to stay. There'll be a sort of stockpile held by the government of lateral flow tests, which people will be able to use. But there is no new money for all of this. All the money has already been allocated to the health department. The agreement in Cabinet had to be delayed today amid last-minute concerns and a split over the money. And sure enough, Sajid Javid, it seems, the Health Secretary, has backed down and is going to have to pay for this without any new money from the Treasury. They've already got this money from the spending review and they don't get any more. It's the same with Scotland and Wales. They are very annoyed. They want to carry on testing for the general public as a sort of precautionary measure. They've been told that they will not get any new money from the UK government, and that if they want to pay for it, they have to find the money themselves in another way and cut something elsewhere. All this is basically a very sharp, hard end to a lot of the support that's existed on and off for 2 years. Number 10 says essentially spending $2 billion a month on free test is not an effective use of taxpayers' money at this point. They have taken a policy decision on this. Some people may say it's the right decision. I feel a lot of people, unions, Labour, the Scottish and Welsh governments, some scientists are going to raise concerns here that this is a step into the unknown. It's going to make it more difficult to know if you have the virus, and that a lot of people are going to be very concerned about this. So Boris Johnson, who has done this to kind of appease concerns in the Conservative Party and in kind of people on that side of the argument, who essentially say, we have been through enough with COVID, we have been through 2 years of restrictions, it is time now to treat this virus as we do the flu and not have legal restrictions. On the other hand, some people will say, is it too soon? Should you keep some things? Should you, for example, spend taxpayers' money on tests that people can use to sort of optionally confirm that they don't have the virus? So those are the main changes. Probably the biggest thing now is that from Thursday you will not isolate if you have the virus, even though you'll be advised to. You don't have to legally. And that from April the 1st, if you get sick, if you get a cough and you want to find out if you have COVID and you want to take a test, you have to pay for that privately yourself. The NHS will not pay for it.